Hey guys, this is Jay Patel from MyFitMed. Today we'll talk about thyroid testing. If you are suffering from the symptoms of hypothyroidism, like feeling tired or gaining weight, make sure you get the lab tested for thyroid function. But when you talk to your primary care, make sure you're getting the complete picture of the thyroid. If you go to primary care and they test your TSH, which most of the doctors will test you, and if your TSH is really high, that means you have low thyroid, and that's the classic thyroid issue. But if your TSH is in the normal range and if you still have all the symptoms of low thyroid or hypothyroidism, that means you have a functional thyroid issue. What that means is you have external factor affecting your thyroid and your thyroid is not functioning at the best. Now there are other tests that has to be done when you want to see the full picture of thyroid. So TSH is one of them that we discussed, but T3 is the active form of thyroid. T4 is the inactive form of thyroid, and the reverse T3 is an inactive form of thyroid. So T3 is what actually gives you all the symptoms of thyroid, meaning if the T3 is low, you'll have all the symptoms of low thyroid, and your TSH may be completely normal even when your T3 is low. In body, what happens a lot of time, the T3 gets converted to reverse T3. So think T3 as the gas pedal and reverse T3 as the brake pedal. If your T3 is good but you have like poor quality sleep, your diet's not good, you're not getting enough nutrients, or if you're sick, has some type of infection, body will slow down and shut down the metabolism, and that means that your gas pedal will slow down and the T3 will convert to reverse T3 and push the brake pedal. That means your body is going to slow down. This is when you start having all the classic symptom of low thyroid, feeling tired, gaining weight. And to optimize your thyroid, you just have to improve your external factor. You may not necessarily a lot of time need actual thyroid medication, but you have to do all the tests to make sure that you see the full picture of thyroid. So the list of the tests you should get it done to see the full picture of thyroid is TSH, which is thyroid stimulating hormone, free T3, total T4, reverse T3, thyroid antibodies, and thyroglobulin antibodies to see if you have any type of autoimmune disorder. This testing will get you the full picture of thyroid, and it will help you understand your thyroid health and what you can do to improve your overall thyroid health, to improve your thyroid symptoms. If you have any question, give us a call, give us a thumbs up, and subscribe for more videos.